Hey, good afternoon, and welcome to UPMC's third quarter calendar year 2020 financial and system highlights media briefing. We have a number of people here today. With us in Pittsburgh is Ed Karlovich, UPMC's Chief Financial Officer, Tal Heppensall, UPMC's Treasurer, and Mark Sefko, President of UPMC Children's Hospital of Pittsburgh. Joining us in Harrisburg will be Phil Garnaschelli, President of UPMC Pinnacle, Lou Berverso, Chief Operating Officer at UPMC Pinnacle Central Region, Deborah Wilworth, Vice President of Pediatrics for UPMC Pinnacle, and Dr. Cynthia DeMuth, the Chair of Pediatrics at UPMC Pinnacle. And with that, let me turn it over to Ed Karlovich. Ed, please go ahead.
Great. Thank you, Paul, and welcome all. UPMC remains strongly positioned as the most preferred provider and insurer across the Western Pennsylvania and across the central part of the state. We have the largest number of medical insurers in Western PA, almost 3.9 million members. And again, we continue to invest in our capital in our various areas that we serve, spending nearly $600 million this year. And you'll hear about some of those exciting activities when Phil Garnaschelli speaks in a few minutes. Our operating income for the first 9 months of the year was $227 million. It's allowed us to maintain our operating activities and also to invest in our capital programs. Our UPMC health plan membership continues to increase. Our outpatient revenues and physician revenues and our admissions are all recovering from the COVID period and have been increasing and are almost back to normal levels. We have about $10 billion in cash and investments that provides for long-term sustainability in our organization and investing in the community as we move forward. Over the course of the year, our investment returns have been around 1%. Our operating revenues continue to grow. For the 9 month ended, we're almost $17 billion in operating revenues. And I would say to you, the most important thing about, what we're doing here from a financial perspective is allowing us to invest in the communities that we serve. And it's with great pleasure that I turn the presentation over to Phil Garnaschelli, who's president of UPMC Pinnacle, and we'll really talk about the important things that we came to talk to you about today, which is some of the exciting and new clinical things that we're doing. Thanks.
Good afternoon. It is my pleasure to welcome our colleagues to UPMC Pinnacle Harrisburg today. My name is Phil Garnaschelli, president of UPMC Pinnacle, and I'm honored to say that I've been part of this hospital and our organization for almost 35 years. I have been privileged to serve in multiple roles, including my current role as president, and to have witnessed incredible growth and innovation in the past 3 years since becoming part of UPMC. In South Central Pennsylvania, UPMC provides services in 7 acute care hospitals and more than 160 outpatient locations in 10 counties. More than 11,000 UPMC employees live and work in this region. Since joining UPMC in 2017, UPMC has invested $910 million, nearly $1 billion already, to elevate the level of care we provide. This investment represents UPMC's commitment to offering world-class care to the people of South Central Pennsylvania. UPMC, among many things, expanded our UPMC Pinnacle West Shore Hospital in Mechanicsburg with an $87.5 million investment. UPMC Pinnacle West Shore offers a larger emergency department and new operating rooms. Opened a new hospital and outpatient center in York, UPMC Memorial, which was a $100 million investment. Brought new minimally invasive procedures to the region for cancer care. Built a new women's and baby center at UPMC Pinnacle Harrisburg with the region's first private room level 3 NICU. $42 million investment. And UPMC has added technology advancements and recruited expert physician specialists throughout our region, all while continuing to take care of our community. In addition to the clinical excellence, we continue to care for our community's needs inside and outside our hospital walls. Last year's hospitals contributed more than $122 million in community benefits. We continue to be our region's community health partner, committed to whether we are providing free flu shots to our Harrisburg community, providing mammograms to the uninsured, or meeting the healthcare needs of the underserved in our clinics and patients' homes. UPMC is there for all people in our community. Right now, I would like to introduce Lou Perverso, Chief Operating Officer, UPMC Pinnacle Central Region, who will share additional details about key services expansions in South Central PA. Lou.
Thanks, Phil. My name is Lou Perverso. I'm the Chief Operating Officer for UPMC Pinnacle. And I moved here to South Central Pennsylvania just about 18 months ago after serving as the Vice President of Operations at UPMC Shadyside. I'm excited to share these impressive initiatives underway in this region and what UPMC has brought to South Central Pennsylvania. In 2019, we introduced the Hillman Cancer Center with the opening of UPMC Memorial in York. In addition, we have planned expansions on the West Shore and the Cancer Center, as well as within women's health. We have also provided access to clinical trials to nationally ranked cancer programs at multiple locations in Lancaster, York, Harrisburg, Carlisle, and throughout the region. UPMC soon will bring advanced neurosurgical care to the Harrisburg region with an addition of the endovascular surgical suite and the recruitment of endovascular trained neurosurgeons and neurologists. We are able to provide complex procedures for patients suffering from stroke or brain aneurysms. For these patients, quick access to care makes a huge difference in recovery. Keeping these patients within our hospital and avoiding transferring to other facilities will be life-changing and life-saving. UPMC has been pioneering heart and vascular care for Pennsylvania since performing the area's first open heart surgery in 1956. Studies prove that higher volumes of cardiac procedures lead to better results. Cardiologists at UPMC perform thousands of procedures each year to open blocked vessels, have extensive experience in ablation therapies for heart rhythm problems, and lead the country in the latest catheter-based valve procedures. Through numerous clinical trials, UPMC is one of a few hospital systems nationwide that is researching new methods for treating heart and vascular problems, transforming tomorrow's medicine through today's research. We are also bringing UPMC's leadership and expertise in organ transplantation services to South Central Pennsylvania through liver evaluation clinics. With more than 14,000 people in the United States currently on the liver transplant waiting list, UPMC Pinnacle is giving access to pre-liver transplant evaluation services and living donor liver transplants, providing access close to home. This complements our existing high-quality kidney transplant program that has provided more than 1,300 transplants since 2000. And lastly, and the focus of today's briefing, we have opened a cutting-edge pediatric inpatient unit at the UPMC Pinnacle Harrisburg Hospital. That brings the nationally ranked care from UPMC Children's Hospital of Pittsburgh to the families in South Central Pennsylvania. The first phase of this inpatient pediatric expansion represents a $12 million investment from UPMC. I'd now like to introduce Mark Sevko, President of UPMC Children's Hospital of Pittsburgh, to share more about the development of pediatric services in our region and across the state.
Thank you, Lou. Good afternoon, everyone. My name is Mark Sevko. I'm president of UPMC Children's Hospital of Pittsburgh. I am honored to say that I've been with UPMC for 25 years, had the opportunity to work in many different hospitals, including being chief operating officer right here at UPMC Pinnacle. At this time, what I'd like to do is share with you some background about UPMC Children's and our plans for Central Pennsylvania. At UPMC Children's, we strive to provide world-class healthcare in everything that we do. Regionally, nationally, and globally, we are at UPMC Children's a leader in treating childhood conditions and complex conditions. We're a pioneer in the development of new and improved therapies, and we are a top educator of the next generation of pediatricians and pediatric subspecialists. We're a big hospital. We're 313 beds. We have a research center that is among the elite facilities of its kind nationally. In May 2019, we celebrated 10 years at our new location in Lawrenceville, which was a $1 billion investment in a pediatric facility in Pittsburgh. We are a magnet designated hospital as well, representing the highest standard of nursing care. We're recognized by many organizations nationally as one of the most innovative children's hospitals, as well as being recognized by Parents Magazine for being one of the most innovative children's hospitals. These extraordinary achievements truly wouldn't be possible without the dedication of our outstanding staff, the wonderful donors in our community, and the incredible patients and the families who come to rely on us and our physicians at UPMC Children's. Patients and families with complex medical conditions and needs increasingly are choosing our hospital because of our physicians, our nurses, our staff, who are among the leaders in their field and are committed to providing world-class healthcare. UPMC Children's is a top 10 children's hospital nationally, measured by the U.S. News and World Report. For every subspecialty measured by the U.S. News, we are ranked in the top nationally, and we're very proud of that. It's rewarding for our physicians and our staff and our nurses who work every day together with the skill and the passion to provide the best care for children and adolescents with the most complex medical conditions. At UPMC Children's, we provide every level of care, from primary care pediatrics up to and including transplantation, where recently we performed a 5-organ transplant on a single patient successfully. I wanted to share with you as well our comprehensive pediatric subspecialty profile. We have over 400 pediatric subspecialists that cover 33 different subspecialties. All of our physicians at UPMC Children's are now trained on the telemedicine platform. We see over 1 million visits per year by our physicians and providers, and now we're seeing 15,000 telemedicine visits per month. We at UPMC Children's were excited and we're thrilled to provide this care to central Pennsylvania and the region. Also wanted to share with you that we have 10 specialty locations geographically dispersed around southwestern Pennsylvania. These specialty locations are where our physicians work, providing care closer to home, where parents and patients live. These specialty centers are where all of our physicians work. We have a specialty center in Hammett, which is 2 hours north. We have one in Johnstown, many in Pittsburgh, and I'm pleased to announce the opening of our UPMC Specialty Center in Harrisburg, specifically at 3 Walnut in Lemoyne, where many of our physicians will live in Harrisburg, and many of our physicians from Pittsburgh will work at the office, providing virtual care or follow-up face-to-face visits. I also wanted to announce that we're pleased to work with UPMC Pinnacle and Children's, announcing a co-branding opportunity where we're bringing UPMC Children's emergency physicians, working with every emergency department in the Pinnacle network, where our pediatric emergency trained physicians will actually be available 24/7 for every child that needs care, for consultation, for patient disposition planning. If a child should be admitted, discharged, referred, or transferred, we're there for all the emergency room physicians that work in the Pinnacle network. We're also very pleased that we're rolling forward with UPMC Children's Anywhere Care, which is a product that provides 24/7 virtual urgent care for every patient that needs it, from a newborn up to 17 years of age. In closing, I really appreciate the opportunity to share this for UPMC Children's, but I want to be clear. Our promise to Central Pennsylvania is quite simple. We plan to provide the best care to the most kids, where extraordinary outcomes are routine, and no child would wait for care or for answers. Thank you. At this time, I'd like to turn it over to my colleague, Deborah Wilworth, who's the Vice President of the Pediatric Service Line at UPMC Children's Harrisburg. Deborah?
Thank you very much, Mark. I am Deborah Wilworth, the Vice President of Pediatrics at UPMC Pinnacle and also the President of the Lancaster region. I began my career as a nurse and also as a mother and a grandmother. I can personally attest to how amazing this new unit is for our patients and their families and our clinical team. It's just absolutely been terrific and tremendous. Our unit is now 26 beds and tied to Children's Hospital that is among one of the most elite facilities of its kind in the nation. We've added 11 new private rooms, which each room designed for ICU care, and we will be using them in a universal model, which means that that child can stay in that room for their entire stay, and we bring the appropriate level of care to them at the bedside. Our comprehensive care team, in conjunction with UPMC Children's and UPMC Children's Harrisburg, is supported by those specialists in Pittsburgh 24/7 with bedside telemedicine. That means we're offering real-time consultation from more than 400 specialty care providers to our children here in central Pennsylvania. This expansion builds on UPMC's expertise in our outpatient pediatric care that's offered through our UPMC Children's Specialty Care Center in Lemoyne. UPMC Children's Community Pediatrics offices, also that are located throughout South Central Pennsylvania, assist in this care. We're harnessing telemedicine technology for our patients, both within the hospital and in the outpatient setting. That way, our children have access to expert clinicians here locally and at UPMC Children's Hospital in Pittsburgh. At this time, I'd like to introduce Dr. Cynthia DeMuth, who is chair of our pediatrics at UPMC Pinnacle, to talk about some of the special features built into the UPMC Children's Harrisburg.
Thank you, Deborah. When I first started pediatric practice in Harrisburg in 1984, we took care of our own inpatients. We made rounds in the morning before going to the office, and then we went back to the hospital again at the end of the day to see how they were doing. Through the years, we have progressed to having all of our inpatients cared for by specialized pediatric hospitalists. And now our patients at UPMC Children's Harrisburg will have 24/7 access to care by all of the pediatric subspecialists at UPMC Children's in Pittsburgh. The new universal bed model is transforming how we are caring for our youngest patients. As Deborah mentioned, the universal room is designed to allow patients to remain in the same room for their entire stay. We can provide any level of care, including critical care, without transferring the patient to another unit or to another facility. UPMC Children's Hospital of Pittsburgh uses universal rooms in their cardiac unit, and they have seen higher quality outcomes and high-ranking patient and family satisfaction since it eliminates multiple patient transfers. For our patients and their families, this also offers consistency in their care team. Seeing the same providers, the same nurses, and same support staff builds trust. Each room is equipped with all of the technology needed to provide care at the bedside. Even the sickest children can receive the care they need right in the same room. Not only have we created a unit that provides technological advancements, but we've created an environment that cares for the social and developmental needs of children. Our child play area is designed with age-appropriate furniture, activity tables, and computerized interactive displays for toddlers, school-age children, and teens. A lounge provides a respite for parents while their children are in the hospital. We're looking forward to adding a dedicated child life specialist soon. This specialist will support patients' psychosocial and developmental needs, working with the patients one-on-one and also in group activities, in coordination with the providers and with their families. UPMC is truly transforming care for our youngest patients. We look forward to growing services for our young patients and their families and increasing the level of care in the near future. And now I'd like to show you a video where we welcome our first patient to the new UPMC Children's Harrisburg. This young lady has been a patient several times throughout her childhood, so it is fitting that she would be our first to transfer to the new unit and experiencing all of the wonderful amenities it offers. This video also includes a brief tour of our new unit.
It's an exciting day today in Harrisburg as we celebrate our new UPMC Children's Harrisburg Inpatient Pediatric Unit. We are so pleased to bring the nationally ranked care of UPMC Children's Hospital of Pittsburgh to families in South Central Pennsylvania.
Ready, set, go!
Of course, we cannot celebrate today without recognizing our employees and providers for their dedication to our patients and their families. It is rewarding to witness the exceptional pediatric care they provide with skill and compassion to children every day. Children's Hospital of Pittsburgh is a leader in the treatment of childhood conditions and diseases, a pioneer in the development of new and improved therapies, and a top 10 educator of the next generation of pediatricians and pediatric subspecialists. With this new unit, children, teens, and young adults will have access to an even more positive and inspiring patient care experience and have the highest quality pediatric health care and resources available to them.
So I would say that you have seen some very exciting things today. And as always, we're proud of what we deliver to this community, as we always close with this slide. But I think today is a very special moment because of the demonstrated commitment we've made to our communities relative to pediatric medicine and the reach of that into the Harrisburg community and the work that Mark has mentioned earlier. So thank you very much.
All right. Thank you, Ed. Thank you all. And now we'll take questions from the media. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the raise your hand button. That will put you in our queue, and then I will be able to call on you and unmute you. Please be sure to unmute the microphone on your end as well. We're going to try to call on as many different media outlets as we can in the time we have allotted. And we'll start with Paul Goff at the Pittsburgh Business Times. Paul, please go ahead.
Hi, can you hear me okay?
Yes, go ahead, Paul.
Thank you. A couple things. One, I wanted to just talk a little bit about or ask why the impact of you're able to see an increase in operating income and revenue. Is that directly related to CARES funding?
I think there are.
Go ahead, Ed. Yes.
I'm sorry. I think there are a couple of things. One is, obviously, as there's been less volume from a hospital and clinical perspective, our insurance company has had an increase in earnings as well as some of its enhanced performance on its community healthcare product, which we've talked about in the past. And secondly, obviously, we have gotten support from the federal government to offset some, but certainly not all of the losses incurred on the clinical side.
Thanks, Ed. I appreciate it. The other question is, what, if any, do you see the impact of potential cut in elective procedures or non-emergent procedures, I suppose, as was outlined potentially by the Secretary of Health yesterday?
Paul, I think that question is best answered by our clinical experts who can't be with us today, and we'll make them available to you as we always have. You know, I would note that the Secretary of Health yesterday said that no region in Pennsylvania would trigger the reductions at this time. So I think at UPMC, we're hopeful that the state's mitigation efforts will be effective and make any such delays unnecessary. We have an email question from Michaela Drapak at WHTM-TV. When did the new Harrisburg Children's Unit officially open? How expensive was it? Let me direct that question to Harrisburg and to Phil Garnaschelli and to Lou Braverso. Phil and Lou, please go ahead.
So the unit officially opened last week, and with our first patient that came in, the investment was $12 million to this phase, with a total project of $17 million when we complete the second phase of this project. Thank you.
Phil, do you have anything to add? No?
No, I think Lou covered it very well. $12 million, and the unit opened last week, and it's absolutely beautiful.
Great. Thank you, Phil. Thank you, Lou. Next question, Natasha Lidstrom from the Tribune Review. Natasha, please go ahead. Natasha?
Trying to press unmute. There we go. Yeah, so it looks like about a growth of about 300,000 insurance members since this time last year. Can you tell us what type of plans contributed to the most growth, or was that across the board? And then related to this, I know this is still going to be months in the works, but any concerns at all about the lingering uncertainty with the Affordable Care Act? And as well, do you expect to see an increase in Affordable Care Act plan signups with more people being uninsured due to layoffs and other issues?
Ed, why don't you take that one?
Yeah. Let me see if I can get them all. From a membership perspective, we've seen growth across a number of our product lines. We actually added membership to the Community Health Choices program this year. With its expansion, we added membership in the Medicaid program as a result of the governor maintaining people on the rolls during this very difficult and challenging time. We've also grown membership in our Medicare program. As far as the ACA goes moving forward, I think we're all watching that very closely. There's been lots of pushes and pulls as to where that's going to go in the future, but we're optimistic that those programs will continue and that we'll be successful moving forward.
Okay, again, to ask a question, please go to the bottom of the page on your Zoom call and press the participants icon. That's going to raise your, that's going to be your raise your hand button, I'm sorry. And that's going to put you in our queue. Once I read your name, please unmute your microphone and I'll unmute from my end. So again, go to the participants icon at the bottom of the page, press the raise your hand button, and we'll put you in our queue. Okay. Hold on, I think we have a question. Paul Goff, go ahead, please. Pittsburgh Business Times.
One other question about this. I guess this would be for Mark Sevko. Is Children's planning to treat any patients in the ICU? I keep looking at the ICU numbers for COVID. Is there other plans for that, or at some point down the line, if needed?
Yes, thanks for the question, Paul. I mean, for UPMC Children's of Pittsburgh to come together with UPMC Pinnacle to develop this, we will be able to take care of every clinical capability. The unit actually is designed with a hybrid medical and ICU capability. So the 11 beds that were presented a little bit earlier, we will be able to take care of children with critical care needs. We have a pediatric surgeon that's working right now at UPMC Children's Harrisburg. We're planning to recruit pediatric intensivists. We have pediatric hospitalists on staff right now taking care of all of our children. And we're actually combining that with coverage from Pittsburgh with a very robust group of pediatric intensivists 24/7 in terms of coverage to the unit at UPMC Children's Harrisburg.
Okay, let's go to Harrisburg, see if Phil, Lou, would you like to add anything to that?
So this is Lou. Sure. We across UPMC have done a lot of planning for our ability to surge when appropriate. The children's pediatric unit here at Harrisburg, non-COVID, has been running at an 80 to 90% occupancy. And so we don't anticipate needing those beds for COVID, but we do anticipate being able to continue to elevate the level of care that we're providing to our pediatric patients. And we do have our surge plans in place for anything else. Thank you.
Okay. Again, go to the participants icon and press the raise your hand button at the bottom of your page to ask a question, and we'll put you right through. Let's go back to Natasha Lidstrom at the Tribune Review. Natasha.
Hi, and I know some of this is being left to the clinical side, but with the pandemic and increasing cases, are there concerns about staffing shortages or how that might affect operations moving forward in these incoming months? I've seen other hospital systems around the country, talking about concerns over that, and even choosing on their own to stop certain procedures because they're just worried about that kind of an issue. Can you speak to any concerns on that level of that?
Well, again, Natasha, I think that question is best directed to our clinical experts, and we'll make them available to you as we always have. We do have robust plans in place to expand capacity if needed. We are a 40-bed or a 40 hospital system with numerous beds. We can transfer patients across our entire system, and we can share staff across our entire system as well. All right, if there are no further questions at this time, what I'd like to do now is on behalf of everyone here at UPMC, we'd like to wish you a safe and happy Thanksgiving. And we'd especially like to express our gratitude to all our frontline healthcare workers for the excellent care they provide our patients each and every day. So with that, that concludes the time that we're going to do for this press conference. Thank you for participating. In about 45 minutes, we'll email to the media attendees a link to download high definition footage of the entire briefing, which we encourage you to use in your news reports. If you have any follow-up questions, please contact our media relations department, and please remember to follow @UPMC News on Twitter for any updates. Thank you very much.